Now let's perform a local traction mobilization to L3, L4, in this case on the right side. First, we need to preposition the segments L2, 3 and up, and L4, 5 and down. To preposition L4, 5 and down, we first want to flex those segments. So I'll place my middle finger at L3, 4 and my index finger at L4, 5. And I'm going to, through the legs, asking the patient to relax, I'll bring the knees closer cranial, opening up L4, 5, but not L3, 4. Keeping my hand there, in order to enhance the side bending that we need for prepositioning in those segments, I'll place the cranial or the sky leg behind the mat side leg. And now that already produces the left side bending that we want at L4, 5 and 5, 1. Next, I'm going to go cranial. I'll place my caudal hand's middle finger in L3, L4, where we're going to mobilize. I'm going to place and I'm going to do this on the sky side of the spinous process. I'll place my index finger in L2, L3 interspinous space on the sky side. So middle finger is L3, 4, sky side interspinous space. My index finger, L2, 3, sky side interspinous space. I'll shift down, grasp the head of the table, and now I'm going to side bend her to her right and want side bending to 3, but not in 3, 4. So I bring her up, and now I have side bending in 2, 3 and up, but not 3, 4. Now, in this position, I'm going to produce a total rotation through the segment that we're trying to treat, and in so doing, the segments above and below the segment I'm treating will lock. I will take my stabilizing forearm and across her iliac, her greater trochanter and ilium, I'll place my stabilizing fingers on the mat side of L4. With my mobilizing hand, I'm going to place the thumb on the sky side of L5, and now I rotate her to her right. In so doing, the segments above are extended because by bringing the shoulder back, it extends the segments. They're side bent to her right and rotated to her right, hence locking L2, 3 and above. At the segment I'm treating, she is rotating to her right and extending, and I'm allowing that segment to side bend as it desires. Below, I've got her flexed, side bent to her left, and rotated to her right, once again locking the segment. My cranial hand will do the mobilizing. Through my thumb, hand, and forearm, I'm going to create a gentle distractive force to the local joint by mobilizing in a dorsal, cranial, and medial direction, this direction. And in so doing, her L3 caudal articular process will separate from her L4 cranial articular process on the right side. It's going to look like this. Here, keeping the sacrum vertical, mobilizing segment doesn't take a lot of movement because I've got segments around locked. I can oscillate for several minutes for improving viscosity, preparing the joint, and using hysteresis to mobilize the joint, and then hold at the end of the segmental range for up to 30 or 40 seconds, using creep to unwrinkle the collagen. At the end of the 30 to 40 seconds, I let off the pressure, and then I can repeat that 30 to 40 second creep mobilization, first oscillating, then holding for 30 to 40 seconds. I can repeat that from 5 to 7 reps. At the end of the 5 to 7 reps, I will repeat the technique on the opposite side, and each of these traction techniques will be accompanied by extension gliding. So I'll do traction, extension, gliding on the right side, traction, extension, gliding on the left side to produce ultimate improvements in segmental extension.